Well, okay. Am I audible? No. Is it fine now? My goodness. Okay. So, speaking noise. Hello. 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 Any echo? Actually, I can listen here. Okay. So, hope my voice is fine now. So, guys, today in this topic, in the session, there is some echo. Hello. Hello. So, guys, in this today's session, oh, no. So, hi everyone. Good evening to all of you. So, my name is Dr. Amit Jain, and I'm your faculty of biochemistry. So today in this session, guys, as you have already joined your first year MBBS and you have already been going through maybe your first terminal exams, right? So today we'll be discussing some points which are very important, which may be important in your first terminal exams, right? Okay, first prof exams will be very late, but terminal exams have already started. Fine. So in this session of webinars and concepts in biochemistry, so I'll be taking some concepts from the beginning. Like, most probably you have started with your topics of carbohydrate metabolism, and, probably right now you're going through the lipid metabolism, or maybe that is also finished. So, guys, in the carbohydrate metabolism, a lot of questions you may have faced which are concept based, like whys, okay, why this and why that. So they are very important questions nowadays, because you are getting questions which are based on clinical cases. Okay, so clinical cases. So like one of the question now today we are discussing is like the question which is based on the cancer cells, that is like why the cancer cells uses glucose as a source of energy. Okay, as a major source of energy. Like if somebody asks you that, as a MCQ, somebody asks you that what is a major source of energy to the cancer cells, so then what will be your answer? So like your answer should be the glucose first of all. But if I say what in the glucose, okay, so what in the glucose? So in the glucose we can say it is aerobic metabolism, right? Aerobic metabolism. Fine. So aerobic glycolysis, the basically the point is aerobic glycolysis. So guys, what is aerobic glycolysis? So aerobic glycolysis is the so what is aerobic glycolysis? It is the major source of energy to the cancer cells, right? And guys, now in this topic we'll be discussing about Warburg's effect. So what is Warburg's effect first of all? So guys, Warburg effect is like cancer cells they uses glucose as a major source of energy and generates lactate even in the presence of oxygen. So even in the presence of oxygen, they are making lactate as a final product. Okay, and this was described by Otto Warburg, and that's why we call it as a Warburg's effect. So, guys, Warburg's effect is also called as aerobic glycolysis. So, if I ask you the question that what is the source of energy to the cancer cells, then your answer is aerobic glycolysis. Don't say anaerobic glycolysis. Okay, because though we are producing lactate, as per the definition of Warburg's effect, the glucose is utilized and converted to lactate even in the presence of oxygen. So now the question arises that first question is that why the cancer cell uses glucose? So guys, why they're not using something else like fats which are giving more energy? As we all know, fats are giving us 9 kilocalories per gram, right? And carbohydrates are giving us 4 kilocalories per gram. In terms of ATP, if we talk about, like that you will read or you might have read already, that palmitic acid in the beta oxidation, it is producing around 106 ATPs. While the glycolysis during the generation of lactate production, it is giving us only 2 ATPs. So the reason cancer cells are using glucose is there are a lot of reasons actually. One of the most important reason that you have to mention in exam is what? So guys, one of the most important reason that you have to mention in exam is that intermediates of glycolysis. So when the cancer cells take glucose, okay. So intermediates of glycolysis, like glucose converts into glucose 6 phosphate. So this glucose 6 phosphate is directly used in the HMP shunt pathway, as you might be knowing already, right? So it is used in the HMP shunt pathway, hexose monophosphate shunt, right? Now, do you remember what is the products of HMP shunt? One of the important viva question and MCQ also. So the products of HMP shunt are two. Number one is ribose 5 phosphate, and number two is NADPH. So these are the two major products of HMP shunt. Now, cancer cells need both of them. Okay, so let's understand one by one. So, first of all, they uses lot of glucose, 10 times 200 times more than the normal cells. So they are taking all the glucose inside, and they are converting glucose to glucose 6 phosphate and then into the glycolysis for making ATP. But this glucose 6 phosphate I can use for what? I can use for making riboses, pentose phosphates, which can be directly used for making purines and pyrimidine nucleotides. And guys, purines and pyrimidine nucleotides are very important for making DNA. Because what is cancer? The uncontrolled cell division or DNA replication, I can say. Okay, so uncontrolled cell division needs the replication of the cell, and that is again the DNA. So to make the DNA, large quantities of DNA, this purine or pyrimidine nucleotides are required, which are made from the pentose phosphates, right? I mean to say base plus sugar plus phosphate, and sugar is provided by the HMP shunt, and HMP shunt is what? HMP shunt is started by the glucose. So that's why, guys, this is one of the most important reason that you have to mention, that the glucose provides substrates for DNA synthesis. Okay, ultimately DNA synthesis, that is the most important job of cancer cells, that is replication. Do you understand, guys? Now, there can be other reasons also. Like, during the glycolytic pathway, we have also 3 phosphoglycerate. As you all know, in one of the step, 3 phosphoglycerate. This 3 phosphoglycerate is utilized in making some amino acids, especially the serine. Now, guys, serine is the amino acid which can convert into glycine. So serine has 3 carbons and glycine has only 2 carbons. So one carbon is released, and this one carbon released will be utilized again for making of DNA, or I can say the one carbon metabolism, which is important in making DNA again, like converting uracil to thymine. Fine, that you will understand a bit better later on in the pyrimidine metabolism. But now you understand that 3 phosphoglycerate of glycolysis can give me some amino acids like serine, which are also important for making proteins, plus also one carbon carriers, which are required for making DNA again. That we'll understand later again. No problem. Okay, guys. So these are the 2 reasons why glucose is preferred. Now, one more reason why glucose is preferred is that, guys, glucose is the glucose is the only fuel, that we can use as in the anaerobic metabolism. So in the anaerobic metabolism, I can use only glucose as a source of energy. No fatty acids I can use. I cannot use amino acids during the anaerobic metabolism. So when the cancer cells grows, the environment in the cancer cells become less oxygen containing, because the mass of the cells is increasing and there is less amount of blood vessels are present there. So in such environment, glucose can be utilized easily as a source of energy, and that is called as anaerobic, you know, ways of using glucose. But we never call it anaerobic glycolysis. Always remember we call it as aerobic glycolysis or the Warburg's effect. Right, guys? So hope you understood this point. Then, why the lactic acid is produced, and what is the reason behind that? Like why cancer cells chooses to make lactic acid? Guys, lactic acid is something, which will be released from the cancer cells, and it will produce a acidic microenvironment around the cancer cells. So this acidic microenvironment, is very beneficial because it helps in breaking the extracellular matrix and invasion of the tumor to the other parts of the structure. Maybe like if we are talking about lung cancer, let's say, so it is breaking the extracellular matrix and helping the tumors to metastasize or to invade into the other parts. So that is one of the reason. Then what is the other reason that you can think is lactic acid causing acidosis. And guys, this acidosis also prevents the B cells and T cells action, that is our immune cells. So they evade immunity or they escape the immunity basically, by preventing the tumor cells to having any side effects from these immunity cells, immune cells, B cells and T cells. So that is one of the second reason that you should know that why lactate is being produced. And there's probably you might have heard that this is the reason nowadays we talk about the diets which are called as alkaline diets. So alkaline diets are the diets which are rich in fruits and vegetables, which makes our body alkaline. Like simply putting just lemon to the water can make our water also alkaline. Okay, so alkaline diets are promoted nowadays. Why? Because acidic environment increases the risk of cancer invasion or cancer growth. That's why. You understood my point? So Warburg effect is a very important question. Though it may not be the Warburg effect directly, but it can be the question that why cancer cell chooses glucose. Ajay, guys, see one more point we can understand here that during the aerobic glycolysis, when the pyruvate is directly converted to lactate, so we have not used any mitochondrial enzyme, okay, for the metabolism of glucose. So because we have not used mitochondria, there is very less chances of production of reactive oxygen species, which are generally produced during the electron transport chain. So now they're not produced. So this increases the survival of cancer cells because ROS or the reactive oxygen species they causes the death or apoptosis of the cells, and that may be just cancer cell. So increasing the chances of survival of cancer cells. Hope you understood this one more point. Okay. So guys, this is the reason like cancer cells chooses glucose as a major source of energy. And guys, we are also using this in the actual diagnostics. Okay, so you may not be knowing a word that is called as PET scan, PAT scan. Okay, PAT scan is like positron emission tomography, and it's a kind of a scan for cancer cells. You just remember the word PAT scan, PET, positron emission tomography, right? So in the PAT scan, guys, we give a variant of glucose that is called as fluorodeoxyglucose, okay, to the patient. And as we know, cancer cells, suppose we are talking about a lung cancer. So cancer cells will take more glucose compared to the surrounding normal cells. And they also have this fluorine atom now attached to them. Okay, so we are able to identify by this PAT scan that what are the cells which are taking 10 to 100 times more glucose than the surrounding cells. Okay, and that is the principle of PAT scan, which is based on again the knowledge of Warburg's effect that cancer cells uses glucose as a major source of energy. Right, guys? So that is like one of the reason. Okay, uh, that we are able to understand the application of this knowledge. That is why the cancer cells uses glucose, right? Okay, so guys, this is one of the very important question and concept that you should remember for your exam purpose. Okay, if you're talking about carbohydrate metabolism first, then there is one more second concept that I want to mention now. So what is our second concept here, which can be asked, very important question in exams, that is like which glycolytic enzyme deficiency causes hemolytic anemia and why? So his answer is, most common answer is pyruvate kinase deficiency, which is seen in the world, seen in the patients. Though I can say other enzymes also, but they are not found to be causing hemolytic anemia till now in patients which are diagnosed with hemolytic anemia. So, guys, first of all, what is the answer? Pyruvate kinase deficiency causes hemolytic anemia. So, guys, do you know what is hemolytic anemia? So, you might have read about RBCs in your physiology section, right? RBCs, they have a biconcave shape, and these are the cells which do not have anything except the cytoplasm. So, they are totally dependent on glucose as a source of energy. So glucose is the only source of energy to them, right? Because they don't have mitochondria, they can't use fatty acids and you know amino acids directly as a source of energy. So they use only glucose as a source of energy. Now, suppose one of the glycolytic enzyme that is called as pyruvate kinase is deficient. So if the pyruvate kinase is deficient, the glycolysis will not occur properly, and which is one of the ATP generating step in the glycolysis. So the number of ATPs in the RBCs, they will become very less. Okay, so if the number of ATPs in the RBCs they become less, what will happen, guys? The sodium potassium ATPase pump, which is present in the RBC membrane, that will become, in I would say like non-functional or less functional. So because of this, sodium will be retained inside the cell, right? And potassium will leak out of the cells. So, sodium being osmotic in nature, what will happen? The sodium will start accumulating in the cells and it will take water inside because of its osmotic effect. The biconcave shape of the RBCs will be lost, and that's why when they're traveling through the small capillaries, they will rupture, their membranes will be damaged and they will be ruptured, and that's what we call it as hemolysis. That is, lysis or breakdown of RBC membrane is called as hemolysis. So hope you understand, guys. Okay, so that is the point that we should understand in the pyruvate kinase deficiency causes hemolytic anemia. Fine, guys. So in this patient, what will the features of hemolytic anemia, guys? When the heme breaks down, so you will discuss this again in your heme chapter when we study the heme chapters in our first year. So we will see that hemoglobin in the RBC is made of heme plus globin, and heme, when the heme is broken down, okay, what is released? Bilirubin is released. The product of heme breakdown is bilirubin. So when the RBCs dies or ruptures or hemolysis happens, the heme converts into obviously bilirubin because that's the end product. And that's why the patient of hemolytic anemias, they present with jaundice and definitely anemia. What is anemia? The less hemoglobin or the less number of RBCs is called as like anemia, right? So the oxygen carrying capacity of the patient will be less. So they will also present with shortness of the breath, because oxygen supply is less, and they are also present with the fatigue. Again, the reason is same, because oxygen carrying capacity of these patients will be very less. Right, guys? So jaundice, fatigue, and shortness of breath, etc. So they will be featured, and in the investigation, you will find that hemoglobin or the RBC numbers count, will be less. Okay, so that's called as pyruvate kinase deficiency anemia. But guys, in general, the most common cause of hemolytic anemia in the world is G6PD deficiency. So, do you know this in name of enzyme? Glucose 6 phosphate dehydrogenase, which is also the rate limiting enzyme of the oxidative phase of HMP shunt. Okay, HMP shunt. So, G6PD is enzyme, which generates NADPH. Fine. It generates the NADPH and pentose phosphate both. So both are produced in the pathway of HM patient. You got it? So that is actually the most common cause of hemolytic anemia. So why the G6PD deficiency? Again, we are talking about carbohydrates only right now. So why the G6PD deficiency causes hemolytic anemia? The reason is very simple. Because guys, in the absence of G6PD, the amount of reducing agent known as G6, known as the NADPH. You know that NADPH now, guys? It's not NADH, it's NADPH. P is there. So the amount of NADPH which is produced is very, very less. And guys, this NADPH is very important in maintaining the active form of antioxidant called as glutathione. Okay, so glutathione is very important antioxidant in our cells, including RBC, and which is maintained by NADPH, because NADPH reduce it, keeps it active, gives hydrogen to it basically, right? And glutathione needs hydrogen to encounter electrons or ROS basically. So, in absence of NADPH, glutathione levels will be less, and that's why, guys, G6PD deficiency causes high oxidative stress and hemolytic anemia. Okay, so you understood? So, guys, that is the most common cause of hemolytic anemia in the world. So, in the world, this is the most common cause of hemolytic anemia, that is G6PD deficiency. Understood, guys? Okay. So for your homework, there is one question, and that is like, what are the three amino acids which makes glutathione? And guys, what is the drug of choice? If glutathione levels are decreased, like in the paracetamol poisoning, which is just a simple drug used for the treatment of fever. So in its overdose of paracetamol, we give a drug which is required for making glutathione. So, what is that drug, or what is that amino acid that we are giving basically? So, what are the three amino acids which make glutathione? Is your homework, right? You will do. So, guys, today we discuss three concepts. Number one, again, that is why the cancer cells use glucose as a major source of energy, including Warburg's effect. Second, we discuss that which glycolytic enzyme deficiency causes hemolytic anemia, and what is the most common cause of hemolytic anemia in the world? That is G6PD deficiency. Fine, guys. So revise these three concepts, which are very, very important. And next time I'll come with more questions on the same topic, especially the carbohydrates and maybe some more on the lipids metabolism. So in the meanwhile, stay healthy and take care. Bye, guys.